Bert just said, I'm André Fouken. I work for a company called Nedap Healthcare. We've been active in the Dutch care sector for about 10 years now. And I wanted to share a bit about what we learned in the last year. Last year we started looking at the relationship between professional carers and informal carers. And that in light with what the previous speakers were saying, it's very interesting to me because a lot of the things they found out obviously match what we found out. We were working on it for about a year, and the main thing we found is that there are two distinct situations in which an informal carer can reside. Either there's one helper or there are many helpers. It sounds ridiculously simple, but that is the main differentiating factor about this kind of support an informal carer would need. If you look at the first group, where there's only one main carer, that carer will take on the main burden of actually providing care to the patient. This presents a unique problem because that burden cannot be shared with anyone else. So the main goal should be to activate other carers, either within the family or within the community, to share in that care. So that's participation, to increase participation. If you look at the second group, when there's a lot of carers, then the main problem we saw was communication and cooperation between them, in themselves, but also with the formal care provider. So here, some kind of cooperative task, something that would help them actually coordinate tasks and communicate amongst themselves better would be required. Both groups, they required something like a link with the formal care. It doesn't matter if there's many carers or single carer. If there's a formal carer involved, there needs to be some kind of communication and cooperation with the formal carer. This can be as simple as sharing schedule information, like when do you actually show up, training, information, stuff like that. It could be very simple, and it all depends on the level of care the patient actually requires. So that led us to actually three very simple concepts that we wanted to solve. We wanted to build something that would support an informal carer and would help the care providers that are our customers to strengthen that bond between formal and informal care and to support informal carers in their day-to-day life. So we found these three main issues: participation, so getting more people involved; communication, getting a structured communication between carers, informal and formal, and coordination of tasks. And we tried to convert that into like a feature set, something we could build to actually help people. And that's why we built Karen. Karen is a website. It's a personal healthcare portal. Again, it's geared towards the patient, but it's very useful for all of the informal carers around it. So it's a very neat example of what the last speaker was saying about an indirect example, a non-specific example. Karen has three main features. It's a social network, it's a shared calendar, and it's a way to communicate amongst each other. Those again match with the three concepts I described earlier: participation, how to prevent someone from going into social isolation; shared calendar, how can we help people coordinate their tasks more efficiently, again, informal and formal together, and how could we structure or formalize the communication between them. What makes us special is that besides these features, we have a long history, almost a decade long, of cooperation with formal care providers in the Netherlands. We have almost 190 care providers in the Netherlands that combined have over 120,000 clients in care. And they are already kind of connected to the system. These care providers have a lot of information that can be useful to the patient, but also to the informal carer. Like, when has a formal carer been around? When will they come around? And in some cases, even electronic patient records, stuff like that. So we wanted to, on the one hand, create a website that would involve all of these features and still be able to match them to the formal care provider. What we actually created was a website that would involve and entangle all of these things. So communication between formal and informal care providers without actually disturbing the process. But that's very important to the formal care providers. They have a way of doing things, and they would like this to be integrated with their way of doing things. And the informal carer has a way of doing things, and they would like it also to be integrated with their way of doing things. So it has to be very easy to use, simple, and well, we wanted to explain it. But it's very hard to explain a piece of software or a website like this. So we asked someone to create a little movie that would explain it in 1 minute, because most of the informal care providers, they will likely spend maximum 1 minute researching this. And I would like to show you that movie now. I hope that the sound works.
Important, right? It shouldn't be buried under a pile of papers or heaped on top of your busy schedule. You can fix that with Karen. Karen is a free personal healthcare tool. It allows you to share information and coordinate care. It's easy. Register online. Invite family members and friends. Add events to the calendar. If you like, link the account to a healthcare provider. They will send a confirmation letter with a secure code. Now you're part of a confidential healthcare network. Think about it. Stay on top of appointments. Schedule a meal plan for your loved one. Keep track of when the nurse visits so you can be there. You're not alone. With Karen, you have a healthcare community. Karen cares for you.
So in short, a very simple explanation of what we tried to do. That would make it more fun and more would try to convince informal carers to try it, because that's the main problem. How do you get people to try these things? Once they've tried it, then usually they'll continue using it, if we've done our job. So in summary, what we tried to do, we tried to create something that would increase participation and communication between carers, both formal and informal, while helping them find information and coordinate their tasks more efficiently. That's just a short summary, again, of all the things I've been saying. How did we do this? It's actually quite simple. Karen is just a simple free website. Everyone can register. It's actually an international website, so it's not only in Dutch, it's also in English. And everybody can register for free. There's also a partnered mobile application. We built that mostly because there's a small but very vocal group of informal carers that needs some kind of cool new thing that they will use to evangelize these kinds of things, to keep people talking about it. On the formal part, we already had a lot of tools that were used within care providers, and we simply integrated them into the tools they were already using. We have 190 customers that use time tracking that will allow employees to keep time, how much time they spend with each client. And we have scheduling solutions, we have electronic health records, and all of these products are now integrated with Karen. So they don't have to change their way. They can simply keep on doing what they've been doing, and all of that information that they will gather will immediately be available in real time to the informal carers. It's very important that it's real time, because one of the main things we found out is that for instance, in an example, that one of the main concerns of informal carers was, did the actual formal care show up? Did the care actually occur? And now they can actually see in real time if someone went to the door, and actually, because we use a real-time scanning system, when someone has arrived, it will be immediately visible in Karen. So it gives some kinds of peace of mind. At the moment, we have about 2,300 active accounts, and we're still growing. We started developing a year ago, but we've only been active for about 6 months. It's not going as fast as we'd hoped. It's hard to convince people to actually use it, and it's even harder to convince care providers to actually use it. Because although they talk a lot about openness and transparency, this is something they're not used to. So it's something of a challenge for us to convince them that it's not only a useful tool for the informal carer, but also for them. Well, that's about our goal. We want not only Karen in every family, but care in every family. Something that will, so every family will have some sort of informal care inside. That's it. You can, if you're interested, you can just go to the website and sign up and try it for yourself. It's free. KarenCares.com. Yeah, that's it.